Closed captioning. Additionally, closed captioning is available. All you need to do is click that CC live transcript icon that you see on your screen, and they should pop up. As I mentioned, if you do have any questions at any point throughout the webinar today, please feel free to click that chat button and type your question. Grassroots staff are monitoring the chat box and can help answer anything, any questions or concerns, and we will have a dedicated question and answer time towards the end with our special guests. So that being said, and knowing that your time is valuable, I think we should just begin with what we're going to cover today. So the short and the sweet of today's webinar is that we're going to learn why and how we engage in global advocacy. And we'll also have a chance to hear directly from two of our rockstar volunteers that have global advocacy experience and talk about ways to get involved. So I think we should just jump right into things with our first expert guest today. Please allow me to introduce Deanna Vaca McGee. Deanna is the Global Advocacy Portfolio Lead for the American Heart Association. She has more than 20 years of experience. In her current role, she brokers and builds strategic alliances to improve public health outcomes with associations, the private sector, and philanthropic organizations, and crafts public health policy informed by sound data and implementation science, managing and overseeing projects in 10 countries. So everyone, please welcome Deanna.
Thank you, David. Thank you so much for that introduction. And it's just such a pleasure to be connecting with our grassroots advocates on a virtual, in this virtual world of today. But it's a pleasure always to talk a little bit about global advocacy. And I, want to begin by just reminding us of our wonderful mission, which is really about a world of longer, healthier lives. And with that, we have a responsibility not only in the programmatic side of the house or in science, but also in advocacy to be able to achieve that mission. And we know that the goal is that health is really a public health good. We have been living over the course of the last several years now with a pandemic that is really associated to health as being, something that has no borders. I mean, the health of our world is going to be knocking at our door anytime soon. And so in global advocacy, what we're really trying to do is join hands and forces with other global partners, like-minded organizations, and ensuring that what we do in the places where we have a presence, that we are really addressing the priorities that governments have set and that communities have set for themselves. And so I, in many ways, like to think about myself as sort of that external facing ambassador of goodwill and good messages coming in from AHA, not only from the science side, but our public policy work, and sharing that and trying to influence the circles that we usually are navigating, which is really around sort of the UN bodies, right? The normative agencies, primarily the World Health Organization, but there are others like UN Women, as well as UNICEF, which addresses issues of our young people. And so that is the kind of the world that I navigate. And I hope that as part of this discussion, we can have a dialogue about some of the questions that you may have or things that you might have heard that the AHA is involved in, and how global advocacy steps in to be a supporting function.
So thank you for that, Deanna. I think that gives us a really good kicking off point here. So, you briefly touched on it, but can you give us a little bit of history around the Heart Association's engagement in global advocacy? For example, when and why did Heart first engage?
Right. So I think, just to back up a little bit, I believe all of you know of Paul Dudley White, who is one of the premier founder of the American Heart Association. Clearly, Paul Dudley White had a vision of the Heart Association and this movement being very global in nature. So I want to start by saying that our founder really had that vision of the world, and really was we have been in and part of the creation a lot of the global organizations now that are dedicated to heart and stroke, like the World Heart Federation and the World Stroke Organization. So we had a huge role in that part. Global advocacy, all to say, really came up, and I was brought in 2011, early in the year 2011, which says I've been here now for 11 years. because there was a pronounced, movement that was building up, that the burden of disease was really around chronic disease prevention and control. And so the Heart Association said, we want to have a person to represent us, to be able to be much more strategically involved in and with our partners to see how we can help to support this broader movement. So it was in 2011 when there was a UN high-level meeting on non-communicable diseases, and that term, non-communicable diseases, really sort of captures all of the chronic diseases, heart being the #1 killer of the world, but also cancer, lung disease, mental health, diabetes, and the others. But all to say, that's when we really began to get involved in 2011 for the high-level meeting. And since then have been actively engaging to ensure that the governments who signed on, including our very own, the United States government, really is held to account, and that civil society organizations like ours have a prominent role to play in bringing solutions to the ground and working collectively and together.
I think that's very interesting. And I think that leads really nicely into my next question. Who is the audience for global advocacy?
So I'd say there's like really 3 buckets. The first of which is our US government. If for those of you who may not know, the US government is the largest donor of global health. And so those dollars really are allocated to health around the world, and usually the lowest to low and middle income countries, the poorest countries around the world. And so the US government has a huge role, not only as a donor, but in influence these multi-sectorial, these multilateral bodies and organizations like the WHO. They play a role on those boards, the World Bank, et cetera. So the US government is going to be critical. Our congressional members, many of our targets are usually the Senate and House Appropriations Committee for Foreign Affairs, and because that's where that allotment of money is really being negotiated and made. The second part of who our stakeholders are similar like-minded organizations whom we have to work with together on this big issue to create a movement. So it's a lot of our global partners like World Heart Federation, the World Stroke Organization, the NCD Alliance, et cetera. But I'd say the third is really the philanthropic and private sector supporters. We know domestically, a lot of the organizations and private supporters that work with us are multinational organizations and employers. And so we want them to also be able to know that we are working and have a global footprint outside of, obviously, what we've heard, which is around the emergency cardiac care space, but very much beyond that in terms of working in health systems. We can't hear you, David.
Thank you. I've certainly done that before. So I appreciate that answer there. And I especially appreciate really tying it into how some of our federal grassroots work really is global advocacy, as working with appropriations, getting money for these things really does matter. So I think that connection is very interesting. I did have one more question to you before we go to our volunteers here. And this is a little personal. Would love to hear from you about what your favorite global success story has been. In your time working here at Heart, what's your proudest moment?
Yeah, so I would have to say, there have been many, but I would say for us in particular, working on the rheumatic heart resolution was a big one. I think many of us know that rheumatic heart disease is an issue that's caused from getting throat infection, strep. And it goes untreated. Here in the context of the United States, we've been able to really, it doesn't exist. But at the global level, it is still a disease that is endemic to low resource countries, in the poorest countries. We were able to work with other partners like REACH and the WHF, the World Heart Federation, to get a resolution at the executive committee to be adopted. And it was adopted and it got the support of many countries that are really suffering from this endemic disease. And so rheumatic heart disease has always had sort of a special place in my heart, because we, as the Heart Association, were really critical in the guidelines associated to rheumatic heart disease. And we have a research network as well, a strategic research network that really focuses on the diseases of the young. And so here we have a lot to contribute, and it was just really wonderful to be able to be part of that rallying cry with governments, where we were able to sponsor an event inside of the World Health Organization, supported, and where Dr. Tedros, who is the Director General of the World Health Organization, sort of opened up and was there with us. So it did, I think it was a success story for us, one that's not told quite often, but it does have an impact when we are able to lock hands with international organizations and governments in support of a cause that really doesn't impact us here in the United States, but we know we're able to eradicate it if we work together. So
I really appreciate you sharing that. That is very interesting, and certainly lends credence to what we do here in Grassroots, right? We are stronger together. If we speak as one voice, if we speak globally with one voice, we can solve some of these problems and allow people to live longer, healthier lives. So I really appreciate that. That's very informative. I do see we're running a little short on time, so I do have one more question, Diana, but I'll save that until the end of the presentation because I don't want to cut any time from our advocates. So Diana, if you would just stay on the line, please feel free to turn off your camera, and I will ask Lisa and Par if you'd please come off camera so we could do the introductions. So everyone, I would like to introduce all of you to two of our very special guests today. We wanted to offer you a chance to hear from volunteers that do have real world experience in global advocacy, and we've got two of the best to offer today. So please welcome Lisa and Par. Lisa is a stroke survivor with over 2 decades of experience as a patient activist and a keynote speaker for stroke, heart, and rare disease. She is a leading advocate for health policy at the local, state, federal, and global levels. She's also a former Go Red for Women national spokeswoman and has served as an advocacy board member for the American Heart Association in Boston and Southern New England. And I'd also like to welcome Par. Par is an American Heart Association Youth Health Ambassador and is a current advisory board member for the Tobacco Endgame. In 2020, and this is what I think is most impressive, in 2020, while studying integrative human biology at UC Berkeley, Par founded the college health advocacy organization called Heart at Berkeley. This was the first student organization to focus on engaging with AHA's You're the Cure advocacy network and supporting local community health campaigns. Through the AHA, Par has represented her organization's efforts at the 2021 World Congress of International Association on Adolescent Health, which is a mouthful, but very impressive. So I just want to say we're super lucky to have both of you as volunteers and advocates, and especially thankful to joining you today. So I do have a few questions that I'd like to ask of both of you, and I imagine the answers are going to be very different given your differing backgrounds. So I'd like to start by asking you, Par, why did you get involved in global advocacy?
Yeah, thank you, David, and thank you for the gracious introduction. I'm really happy to be here. So my interest in global health actually stems from my Nepalese heritage. I was born in Kathmandu and I immigrated to the US when I was fairly young. So I've kind of had the privilege of observing and learning about first and third world healthcare systems. And then, as you mentioned, during my undergrad at UC Berkeley, I kind of gained deeper understanding and perspectives about global and community health, as well as health policy, which drew me to global advocacy.
That's very interesting. And obviously, you do have a unique background for this, and it's great that we've been able to work together on so many things. So now, Lisa, I'd like to kick it to you. How did you get involved? How and why did you get involved in global advocacy?
Great. Thank you, David, for the introduction. So mine was a little bit different. As a stroke survivor, in 2001, I started my volunteer work with the Heart Association because I wanted to share my story with legislators in DC. And over the past 20 years, I've had many different opportunities to share my story and impact policy change at the local, state, and national level. I started realizing there was advocacy even more than just nationally when I did some of the different advocacy days in DC, because as we were advocating for funding and different things, we realized that some of these prevention, for example, needed to go higher than just the nationally. So I have been blessed to do a White House cardiovascular summit. I was actually part of a tweet chat in the Oval Office, and it was there that I started realizing there was more than just national. And all of this led to an experience where I was afforded an opportunity to advocate on a global level by representing the Heart Association at a non-communicable disease global forum for civil society in Tokyo, Japan. This was a couple of years ago, and as a patient, I was asked to present and share best practices to impact their development of a global strategy for cardiovascular health.
That's very interesting stuff there. And I especially love how we see that connection with what Deanna was saying about working with appropriators in Congress for these global issues. So we kind of see how it comes full circle. That's really interesting. Lisa, I'd like to stay with you on this for now. Can you give us a few examples of ways that you've engaged in global advocacy, including perhaps your favorite experiences and what issues you worked on? I know you just mentioned one, but are there others?
Yes, and so I've been very lucky to attend the International Stroke Conference, scientific sessions, and different events like that over the years. And when doing that, obviously I'm speaking to international representatives. So I've always had a touch of that. Most recently, even during COVID, there is Our Views, Our Voices initiative, and I've been able to share some of my perspectives with that group. I've also submitted comments on international programs over the year. But I have to say my favorite experience was the Global Forum. And I was one of 8 speakers, and we were there to develop a patient-centered healthcare system for the country of Japan. And we were looking at various stages of prevention. And I was lucky enough to share a very successful promotion program, which is Go Red for Women. And as a spokesperson, I was able to speak to my experience with the program, some of the best practices that I saw and that we see as an organization, and really educate the group of speakers and high-level officials in Japan on the Go Red for Women international program and what we do. My presentation was really well received. Japan fully embraced the idea of incorporating this awareness campaign in its development of its basic act for cardiovascular disease measures. One thing I think is interesting and that I learned as I was there, of course, we're using translators. And when I said the word awareness, that is translated in Japanese to enlightenment. So to them, enlightenment was part of what they want to do to their patients. And so being part of that was really exciting and kind of a neat way to look at our awareness, even at the national level. And the success was that the members of the Health and Global Policy Institute fully plan to incorporate this national program of ours in their national program.
I think you may have undersold that. That sounds like a resounding success. So congratulations there. That sounds like a very, very cool experience.
It was, thank you.
And so Par, same question. Would you give us an example of ways that you've engaged globally and maybe talk about what your favorite experience was / what the outcome, if there was an outcome?
Sure. Thanks, David. First, I just wanted to say that I think Lisa's story is so inspiring, and a lot of the amazing things that she's been able to do as an advocate, I hope to be able to do at some point. But to talk about kind of my favorite experience, you've already given a little bit of background, David, into the work that I did during my undergrad, kind of trying to increase student engagement with the virtual advocacy network, You're the Cure. So Deanna and the AHA team actually offered me this incredible opportunity to present at the International Association of Adolescent Health World Congress in November of 2021. And that's been my favorite experience to date. The event was actually hosted in Lima, Peru, but I attended virtually, of course, because of COVID. And this actually tied into my presentation pretty smoothly because I had the honor of discussing my organization's efforts with You're the Cure during the pandemic, and also encouraging greater engagement in health policy through virtual health advocacy. So, given that health disparities kind of manifest in different ways around the world, my presentation sparked some important conversations about how to encourage adolescent health equity through virtual community advocacy interventions. And when Lisa was talking, I was also remembering, kind of, because it's been a little while, how we also had translators during our event who were kind of connecting our presentations in different languages to people around the world. And what an amazing experience that was to be able to share those perspectives from people who had been working with so many different types of patients and who understood all of these unique healthcare priorities. And then kind of the cherry on the top of my experience was that I got to write about it for You're the Cure's advocacy newsletter. So that was great to also connect it to other advocates here and hopefully encourage young advocates who are looking to get involved in global advocacy also.
Well, and I really appreciate your plug there for our newsletter. That's the Advocacy Pulse. If you're not already signed up, we would definitely encourage you to do so. And so that, yeah, that is really interesting. And I think it's especially interesting how both of you have these global opportunities from completely different backgrounds, yet have similar reasons for why you are all engaging. And I think that's both impressive and really interesting. So Par, sticking with you, you've now had experience. You are a youth ambassador for Heart. You are an Endgame advisory member. You've got a lot of experience in advocacy, and that's in spite of your age. Given all that you've worked on locally, statewide, federally, and of course globally, would you recommend that other You're the Cure advocates engage on the global level? And do you have any personal reasons for why you think they should do it?
Yeah, so short answer, definitely. I had a very positive and encouraging experience with global advocacy through You're the Cure. Deanna, Dr. Michelle Farmer, Diamond, Betsy, Amy, and the rest of the AHA team were so supportive and helped all of the World Congress presenters who were coming in from the AHA. So we got support with, formatting PowerPoint slides, exchanging supportive email threads, and we even had the opportunity to debrief and kind of practice our presentations and things. So for something that's such a big event and to have that honor, we really went in feeling prepared because of the support that we got from the AHA. And to other young advocates who might be listening, I can totally empathize with any feelings of nervousness or doubt that may come from people who are hoping to get involved with global advocacy. It might feel like you're not qualified enough or don't know the quote unquote right thing to say. But I think part of the beauty of global advocacy is listening to and sharing stories, right? And so everyone has an important story to tell, and the powerful stories that you get to hear back from other advocates is something that can be totally mindset shifting. So even just for that, I think it's really important to get involved with global advocacy.
That's great. I really appreciate that answer. And I'll try not to get a big head for all of us at Heart with those nice words that you shared. But that is something I think it's really important to touch on is when we're asking advocates for help, we are here, we are a resource, we're here to support you and make sure that your voice as an advocate is as strong as it possibly can be. So I think that's a great point to hit on. Now, Lisa, I'd like to end with you. You've got more than 2 decades of experience in this field. And so similar question to Par. Given your experience, did you find value in the global advocacy work that you've done? And would you recommend others do it and why?
Yes, thank you, David. Actually, Par, listening to you, I love what you're doing, and I love that you're doing it at such a young age. And it's interesting because I did it at a young age, but I call myself an accidental advocate because I didn't like being a stroke survivor in my early 20s, and I wanted to do something to make a difference. So I fell into advocacy, but I've loved every minute of it. And I think over the years, I've been blessed with so many different opportunities, and it just kept getting a bigger audience, more of an audience. And I think that's wonderful because it's giving me an opportunity to grow as an advocate, but it also helps me and the Heart Association impact others by sharing stories of success and of hope. And so I've been very lucky for that. I will say that, as Par just mentioned, kind of the nerves, I was very nervous going to Japan. I was very nervous flying across the world. It was an amazing experience. It was definitely out of my comfort zone, but I highly recommend you do it because it was one of the best experiences of my life. I didn't know how it would work, and I didn't know if the right words would come out, but again, it was connecting with the people in the room. And not only did it build my confidence, I had a really unique experience. The rare brain disease that I have is called moyamoya disease, and it is founded in Japan. So when I was sitting around the room with the top officials there, I mentioned the word moyamoya as a rare brain disease, and everybody in the room was shaking their head. And it's when I realized that in Japan, it is not rare, it is common. And that gave me a goal to make it less rare here in the United States. So not only did it help representing our organization, the American Heart Association, with others, we helped develop their program. And also it gave me hope and inspiration for what I want to do here in the United States. So it is wonderful. My hand was held. Deanna provided me with so many documents, so much information to share. But ultimately it came down to stories and connections and really just providing the expertise that the American Heart Association has to other countries where they don't have that awareness, that enlightenment. So we were helping each other and it was really awesome. So yes, I encourage you all to look into the opportunities that exist at the global level because it really can be life-changing.
I really appreciate that answer, and both of your responses to me are incredibly inspiring. It's not just your actions and your words, it's everything that the two of you do. Truly inspirational, and we really appreciate that. So I don't see any questions in the chat here. So Deanna, I was hoping you maybe could come back on camera for my one last question that I do have of you.
Sure.
And
And-
that would be, oh, go ahead.
But before you say it, thank you, Par and Lisa, for all that you've done to elevate global advocacy at the Heart Association. I think you are the best champions. And like we say here in the context of the nationally, our volunteers are really where the heart is. So I am endowed to both of you and the work that you do because you make us all look fabulous. So thank you.
I definitely agree with everything Deanna just said there. So my last question is just if folks are interested in participating in global advocacy, Deanna, are there any next steps that they can take so that they can put their name on a list or get in touch with you?
Yeah, thank you, David. So we have been working really closely with Amy Mancy, who runs the grassroots operation, to really be able to start identifying where the interest is. And so I would highly encourage you, if you want to raise your hand and you're interested in working in global advocacy and learning a little bit more about how our calendar works, because there is a global sort of advocacy calendar, so to speak, just like there is a legislative calendar at the state level, there's one similar. And we get invited oftentimes to be part of these consultations and to weigh in and to put our stories forward. Just please let us know. You have my name now, but David and Betsy, Josh and Amy and the grassroots team really will be able to funnel and navigate you to me and share with you those opportunities. So know that they come up. Sometimes they come up not with a lot of, really quickly, and I've got to turn it around. So I'm apologizing in advance, but we certainly would welcome engaging you. If you have an affinity to another part of the world, something Par mentioned and Lisa as well in your presentations, please let us know that. And any language competencies, I am in great need of people who speak Spanish, oftentimes French, Arabic, where we're really invited and asked to come. And we know that anytime we're able to speak in first tongue and first language of those countries where we visit, it makes a huge impact. So think about those things, and I look forward to hearing back from you.
Well, thank you very much, Deanna. I really appreciate that. And that should wrap things up for us today. I'd like to thank all of you for joining us and for all that you do to help us build a world of longer, healthier lives. I'd also like to give a special thanks to our 3 guests today, with a special emphasis on our 2 volunteers. We really appreciate your time. A reminder that this chat was recorded and we will be sharing a copy with all the registrants. And if you do have any questions later, please feel free to let us know. We will be including contact information as well as the recording. So if you do have anything that comes up later, please let us know, especially if you'd like to get involved. So with that, I will say good day. Thank you, everyone, and have a great rest of the day.